Metabolic keys, diabetes basics and updates. Type 2 diabetes usually does not start on the day of diagnosis. It starts earlier while the body is still trying to keep up behind the scenes. Research priority. Verify current claims against U.S. government websites for benefits topics and against the American Diabetes Association or other major primary institutional sources for diabetes and metabolic health topics. A lot of people hear type 2 diabetes explained in a way that makes it sound as if blood sugar suddenly became the whole story overnight. What usually changes first is more gradual. Long before someone sees a dramatic number, the body may already be struggling with insulin resistance, rising glucose after meals, and a pancreas working harder to keep up. That slow shift is why the early stages can be easy to miss and emotionally hard to understand once a diagnosis finally appears. Type 2 diabetes develops when the body can no longer keep blood sugar in a healthy range with the tools it has been using. In many cases, insulin resistance builds first. The pancreas increases insulin production to compensate. Later, the system cannot keep pace as well, and blood sugar starts staying higher for longer. That does not mean everyone follows the same timeline, but it does mean type 2 diabetes is usually part of a process rather than a random event. Understanding that process matters because it helps people stop treating the diagnosis like an abstract label and start seeing what the body is actually struggling to manage. Before the diagnosis becomes official, the changes can be subtle. Blood sugar may spike more after meals, morning glucose may trend up, cravings may feel harder to manage, energy may become less stable. Some people notice more thirst or more nighttime urination. Others notice almost nothing and only discover the problem because routine labs caught it. That matters because many people blame themselves for not noticing earlier, when in reality, the body can shift quietly for a long time before the pattern becomes obvious enough to name. In real life, the early clues are often not dramatic enough to force attention. Someone might feel more tired, more thirsty, slower to recover energy, or more frustrated by how hungry they feel after eating. Another person may notice nothing obvious at all and only learn something changed because routine labs caught it. That is part of what makes this topic hard. The body can be compensating for a long time before the message becomes clear enough to interrupt daily life. One common mistake is thinking the diagnosis only matters if symptoms feel extreme. Another is assuming the goal is to become perfect overnight. Both reactions create unnecessary fear. Type 2 diabetes is serious because long-term blood sugar patterns affect the whole body, but the first job after diagnosis is not panic. The first job is orientation. What are the numbers? What changed first? What is the current treatment goal? What part of the daily routine is making the biggest difference? A diagnosis of type 2 diabetes does not automatically mean immediate complications, personal failure, or a life that can never feel normal again. It means the body needs more support and clearer management than it has been getting. That distinction matters emotionally. People make better decisions when they understand the diagnosis as information rather than as a verdict. The goal is not shame. The goal is to reduce long-term risk, protect organs and blood vessels, and build a plan that someone can actually live with for the long haul. Good orientation means learning the basic language of your own case. What was the A1C? What does that number represent? Is fasting glucose a main issue, or are after-meal spikes a bigger issue? What medication was started, and what is it supposed to change? Are blood pressure, cholesterol, kidney function, or eye screening also part of the conversation? When people understand what is being monitored, they stop feeling like diabetes is one giant blur and start seeing it as a set of manageable decisions that connect to real outcomes. One of the hardest emotional parts of type 2 diabetes is that numbers can start feeling like judgments. People see one high reading or one difficult week and decide they are failing. That mindset usually makes management worse. Monitoring works better when it is treated as feedback. A1C is feedback. Finger sticks or CGM trends are feedback. Weight trends, medication response, sleep, meal patterns, and activity levels are feedback. The whole point is not to prove you are perfect. The point is to understand what is changing so the plan can be adjusted intelligently. When someone learns to think in patterns instead of moral verdicts, diabetes becomes easier to manage and much easier to discuss calmly with clinicians. A useful medical system question is not just, "Do I have diabetes?" but "What pattern are we tracking and what is the treatment plan trying to improve first?" That may include A1C, fasting glucose, after-meal blood sugar, weight trends, medications, kidney markers, blood pressure, cholesterol, or eye and foot follow-up. Bring the confusion into the appointment directly. Ask which numbers matter most right now, what the next lab timeline is, and what change would tell the clinician the plan is working. The more clearly someone understands what the care team is watching, the less mysterious the process becomes. You are newly dealing with type 2 diabetes. Focus on understandable routines. Learn what your main numbers mean. Ask when and why to check blood sugar if monitoring is part of your plan. Build meals that are more stable instead of swinging between restriction and chaos. Move consistently. Keep follow-up appointments. If medication is part of the plan, ask what it is supposed to improve and what side effects or red flags you should watch for. The goal is not to know everything at once. The goal is to become steadily more informed. What you do not want to do is bounce from one extreme to another. Many people go from ignoring the problem to trying to fix everything in 1 week with a punishing plan they cannot sustain. That often creates burnout, guilt, and confusion. A better response is to build stability, keep medical follow-up, learn the numbers, understand how meals affect you, move consistently, take medication as discussed. The most effective diabetes management usually looks more like repeated steady choices than one dramatic reboot. Long-term care usually becomes more manageable when the viewer stops thinking only about the diagnosis day and starts thinking about the support system around the diagnosis. Do you understand your medication plan? Do you know when labs are due? Do you understand whether blood pressure and cholesterol are also part of your risk picture? Are eye exams, kidney markers, and foot care being handled? Are you getting credible information instead of doom scrolling every new headline? Type 2 diabetes is not just a number problem, it is an ongoing systems problem. The people who do best are usually not the people who are most frightened. They are the people who become more organized, more informed, and more consistent over time. Progress gets easier to sustain when the daily routine stops feeling like punishment. That may mean finding meals you can repeat without getting bored, learning which foods keep you fuller and more stable, using movement in a practical way instead of as self-punishment, and understanding what your medications are actually supposed to help with. It also means accepting that diabetes management will have imperfect days. The people who stay with the process longest are usually the people who build routines that still work when life is messy. That is an underappreciated part of good diabetes care, not just knowing what helps, but setting things up so you can keep doing it. What changes first in type 2 diabetes is often the body's ability to keep up quietly behind the scenes. The earlier that pattern is understood, the more likely someone is to respond with strategy instead of confusion. Clear information helps people make calmer decisions, and calmer decisions usually work better over time.